Hello, I'm here to tell you about a new product from DHD Healthcare. CircuVent is a medical device designed to provide the ability to administer aerosol medication during mechanical ventilation when a heat and moisture exchanger or hygroscopic condenser humidifier is utilized. Heat and moisture exchangers, commonly called HMEs, are an alternative to the use of humidifiers in the ventilator circuit. The use of HMEs has created a problem for the clinician when delivering aerosolized medication to the patient, as the recommended position for aerosol delivery is distal from the patient, that is, on the ventilator side of the HME. In order to deliver the medication, the clinician must remove the HME from the circuit, breaching the integrity of the circuit and interrupting PEEP each time an aerosol is delivered. CircuVent is an innovative new product that allows the clinician to preserve circuit integrity, deliver aerosol medication, and maintain patient PEEP. These are clinically important benefits to ventilator-dependent patients. Current clinical practice requires removing the HME from the circuit to administer an aerosol treatment. Every time an HME is removed and reinserted, the risk of contamination and nosocomial infection may be increased, and patient PEEP is affected. Now let's see how CircuVent can improve current clinical practice. Attach the HME currently used at your facility to CircuVent. In some situations, the clinician may be aware of the patient's need for aerosol prior to instituting mechanical ventilation. If this is the case, then CircuVent may become part of the circuit assembly before mechanical ventilation is initiated. Make sure that CircuVent is assembled in the circuit so that the black arrow is pointing toward the HME, directing the ventilator gas through the HME. Remember, the arrow is always pointing in the direction of flow. When an aerosol treatment is required with either MDI or aerosol nebulizer, the CircuVent dial is twisted until the arrow points to the bypass and clicks into position, so that the ventilator gas is directed towards the bypass. This will assure that the aerosol medication bypasses the HME. With one quick turn, we've selected the bypass and are ready to begin aerosol therapy. When aerosol delivery is completed, simply turn and click the indicator dial back to the HME position with the arrow pointing to the HME, and the ventilator gas is directed back through the HME. Remember, the arrow is always pointing in the direction of flow. Now, let's review the advantages of using CircuVent. CircuVent may decrease the risk of infection by avoiding the disconnection of the HME from the ventilator circuit when aerosol medications are required. CircuVent may decrease the risk of contaminating the HME because the clinician does not handle it once it is part of the circuit. CircuVent does not cause an interruption or loss of patient PEEP. CircuVent saves clinician time during delivery of aerosol therapy. CircuVent's standard connections allow it to be used with the customer's choice of HME. CircuVent may save the cost of using multiple HMEs depending on each institution's protocols or procedures. CircuVent's translucent construction allows inspection for occlusion. CircuVent does not occlude the ventilator gas flow in any valve position. CircuVent is intended for single patient use and should not be disassembled. However, its exterior may be wiped clean with alcohol. DHD Healthcare is pleased to provide you with a more clinically sound alternative to aerosol delivery for mechanically ventilated patients requiring a heat and moisture exchanger. DHD is committed to the development and improvement of respiratory devices benefiting both patient and clinician.